this is Dr. Lindsay Remy. I just wanted to talk to you a little bit about knee replacement surgery. First of all, what is knee replacement surgery? Knee replacement is when we resurface the ends of the bones. So that comes in two different forms. There's partial and there's full knee replacement. This is a model of a full knee replacement. So you can see that the ends of the bones have been capped with metal. This is the femur side, and this is the tibia or shin bone side. And then there's this plastic piece that fits in the middle. I do my knee replacements with preserving the ligament in the back, the PCL, but you do end up taking out the ACL in the middle of the knee. All forms of knee replacements maintain the ligaments on the side of the knee for stability. And then on a case-by-case basis, I may resurface the kneecap side, the patella. You always have your own kneecap. The kneecap is never removed, but sometimes your kneecap is in good shape and we don't have to do anything with it. Sometimes it needs to be resurfaced also with a little plastic button like this. The metal in a knee replacement is attached to your own bone, either through what's called press fit, which is when we have a special type of metal that the bone will actually grow into, sort of wedged into place, and your own bone will grow into that metal with a specialized coating, or what we call cement, which is really more of a glue or epoxy coating that seals the bone to the metal. And I also make that decision on a case-by-case basis, depending on your bone quality, your age, your risk factors for your body's ability to heal the bone or not. I do all of my knee replacements with the Mako robotic technology. I really love the Mako because it allows me to get really precise positioning of the implants. So for you, what you need to know is that does require me to get a CT scan ahead of time, and that allows me to plan out exactly where your bone spurs are, exactly how much deformity of your knee you might have in terms of angle of your bones, and the correct sizes of the implants. So I know all that information ahead of time. And then during the surgery, I take measurements of your ligament tension and I make some changes to the plan to decide exactly where your knee replacement components will go. And then the Mako robot comes in, it's sterilely draped, and it is still my hand controlling the saw, but the saw attachment is what is really the robot portion, and it is finalizing, keeping the cuts exactly how I had made it in that computerized plan with the combination of the CT scan and the measurements I took. The Mako robotic-assisted knee replacements have been shown to have slightly less pain in the first 6 weeks after surgery, but to me the main advantage is really the precision that it allows me to have. Let's talk a little bit about anesthesia. This is a major surgery, and so you are experiencing anesthesia for it, but most people don't need general anesthesia. We do a multimodal, so many different types of pain control in order to keep you as comfortable as possible. That typically includes a spinal anesthetic, so numbing medicine in your back with sedation. So you don't have to worry about remembering anything about the process of surgery. You will be asleep from the sense of no awareness, but most people don't end up needing any type of breathing tube during their anesthetic. We also use an adductor canal block. The anesthesiologists do that numbing medicine in your leg. And then I, during the surgery, will put numbing medicine also behind the knee to the parts that aren't covered. While most people are very happy that they had their knee replacement done, there's 15 to 20% of people that still have pain. That can be because of the skin, scar tissue, tendons, ligaments around the knee still hurting, so things other than their original arthritis could still be hurting, or they could be experiencing referred pain from their hip, back, or other area. If you're still hurting after a knee replacement, we work together to try to find the cause of that pain and to try to get you better. But I need you to know that a knee replacement is not a guarantee that you will be pain-free. Knee replacement also comes with some medical risks. So because this surgery is putting stress on your body, you're at more risk for medical complications after surgery compared to just normal day-to-day life. Some of those risks are things that you wouldn't even think about, things that don't seem directly related to surgery, such as a risk of pneumonia or urinary tract infections. Those are higher in the first month after surgery. It also is putting stress on your heart, so especially people with pre-existing heart problems are at more risk of having a new heart rhythm issue or even a heart attack or stroke after surgery. It's really important that we get your medical problems as perfectly dialed in and controlled before surgery as possible to reduce your risk of those complications afterwards. For example, if you're a diabetic, it's very important that we get your blood sugars under excellent control ahead of time, because we really want your blood sugars to be as close to normal as possible in those weeks afterwards, so that your risk of complications such as infection is as low as we could possibly get it. There are some unique risks of knee replacement that have to do with the specifics of the surgery, and I wanted to go into just a few of those that I think it's important for everybody to know about. One of those risks is that where the metal attaches to your bone can loosen over time. Typically that happens later, the farther out you are from knee replacement, but unfortunately it can happen at any time where it wiggles itself loose. The other risk is infection. We typically think of infection as happening right after a surgery because your incision is still healing. But the unique thing about knee replacement is because there is metal in your body, that metal can be a place for bacteria to attach to from your bloodstream. And so infections can actually happen of your knee replacement for the rest of your life. Thankfully, that is a rare complication, but it can be really devastating when it happens. So one of the things I ask people to do in preparation for surgery is to make sure that all of their health is as good as possible to reduce that risk. For example, even your dental health matters. If you had a dead or infected tooth, that could travel through your bloodstream to your knee replacement. So I do ask you to have your dentist sign off that your teeth are in good shape before we go through with this surgery. The other couple risks about knee replacement that I always mention are the risks of stiffness. So this surgery creates some scar tissue that you have to work through in physical therapy. The risk of instability or feeling like your knee is too loose, which could require a revision surgery. And the risk of fracture. So especially if you take a fall in the first weeks after surgery, you can crack the bone as it's adapting to the unique stress of the knee replacement. Of course, there are other very, very rare complications that I won't go into today, but those are the highlights that I feel like every person needs to know. Please ask me if you have questions about any of those complications or any of the more rare ones. You want more information, I'm happy to give that to you. In terms of reducing your risk for surgery, we have already talked a little bit about managing your medical problems, making sure your teeth are in good shape. The third thing that I wanted to bring up about optimizing yourself in preparation for surgery is nutrition. If you can really get your body as strong as possible from a nutrition standpoint before surgery, you can help yourself heal. I recommend everyone get 1 gram of protein per pound of ideal body weight in the weeks leading up to surgery and in the weeks afterwards. You also want to make sure you're getting all of your other nutrients. So for example, eating plenty of vegetables and complex carbohydrates, taking a multivitamin if you feel like your nutrition might be deficient in something can be a good idea. Of course, I always defer to your primary care doctor as the true expert in your health, but those are some general parameters that I give people to optimize their nutrition for surgery. The other way you can help prepare yourself for surgery is to make sure you are as strong as possible. The more time and effort you put into getting your body strong before surgery, the faster you'll recover afterwards. Many people don't realize how much muscle they have lost in the years of their knee arthritis until they start recovering afterwards. And then they realize, wow, my muscles really did shrink up after all of this time. So you can help yourself now, even though your knee is hurting, you can still build up muscle. If people are able to, I do encourage formal physical therapy ahead of surgery to really get your body as strong as possible. But I understand that's not practical for everyone to get there. And so at a minimum, I ask you to please do some strengthening exercises on your own, focused on your quadriceps and your hips. Not everyone can get to formal physical therapy, but you can get stronger on your own. There are lots of free resources on the internet of how to strengthen your legs before knee replacement surgery. You can search for that and find things, and I can also give you handouts and resources if you have specific questions. But your goal is really to get your muscles of your thighs as strong as possible ahead of time, especially your quadriceps, which help you stand up from a chair. If you have trouble standing up from a chair ahead of surgery, the recovery afterwards is going to be a little extra challenging, because remember, your leg is weak right after you've had surgery. It takes several weeks of recovery before your muscles are as strong as they were beforehand. So practice now getting up and down from a chair and make sure that you really feel strong doing that. That's all for today's video. I hope to see you soon.